Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is what you need to know about occipital nerve blocks. An occipital block is an injection of numbing medicine next to the occipital nerves, which are located on either side of the scalp and originate at the neck. So you can see what they look like on the right and the left side. There is actually a greater and a lesser occipital nerve, and either one of these can produce pain. Neither one has a motor function. It's only sensory on the scalp. Okay. The injection is designed to stop the pain which travels along these nerves and can lead to occipital neuralgia, cervicogenic headaches, or migraines. The injections actually have two purposes, both diagnostic and therapeutic. First of all, you want to see, if in fact these nerves are causing the headaches, okay, and then therapeutic, you want it to last, for as long as possible. The symptoms of occipital neuralgia include pain in one or both sides of the head. Patients will often have a tender scalp, and it may include an aching or burning, throbbing pain. Also can be described as a sharp or electrical shock in the back part of the neck and the head. So who benefits from these blocks? Occipital neuralgia patients, those with pain on one side of the back of the head, benefit the most. Those with migraines can often benefit. Cervicogenic headaches, by definition, that means any headache caused by the neck. That's typically one-sided. And cluster headaches are one of the most painful headache types that can also benefit from these blocks. How is the procedure performed? Occipital blocks are quick. They can be done in the office. They don't necessarily need fluoroscopy, real-time x-ray. There's no need for sedation. It can basically be done in an exam room. The pain doctor can feel the point of the maximal tenderness at the base of the skull, and then the doctor moves the needle to inject both nerve areas, the greater and the lesser occipital, with numbing medicine, which may or may not include some steroid along with it. Okay, so they can basically come in with the needle and then just do a fan of the medication. How well does the procedure work? Well, for such a quick, low-risk procedure, it works amazingly well. Often gives pain relief within minutes. For cervicogenic headaches, studies show anywhere from a 50 to a 90% response rate, averaging 3 to 4 months. I'm sorry, 2 to 4 months. Okay. Cluster headaches give an 85% response rate with the injections, which can be 4 weeks to 4 months. Occipital neuralgia has also an 85% response rate for 1 to 2 months. And then migraines is not bad, 60% response rate, averaging 4 to 5 weeks. Now, if these work and then they wear off, they can be repeated with the expectation that the results are going to be the same. So you can repeat the procedure, or if it wears off, you can actually do this procedure here, which is called a radio frequency ablation. Okay, and that's when a needle goes in. It's actually kind of like a catheter, and then heat is put along this. The radio frequency energy is what it's called, and this can deaden the nerve or modulate it to where it just doesn't cause the pain that it was before. There's really no large studies available to show how well this works, but smaller ones are showing that it works very well, and it's a very low risk procedure. Are there risks? Minimal. There might be some slight bleeding. It could be an infection, allergic reaction. I mean, the needle's way outside the spinal canal, and these nerves don't have any motor function. They're not lifting an arm or anything like that. So therefore, there's no risk of a cerebrospinal fluid leak or spinal cord injury because you're way outside. I mean, the spinal cord is in here. I mean, you're way up here, outside any of that. Okay. The top pain management clinics in Colorado is Colorado Pain. They offer comprehensive pain management, including medication management and interventional procedures such as occipital nerve blocks. They have several locations in the metro Denver area, and over 50 insurance plans are accepted by the board-certified pain management doctors who've won the Patient's Choice Award 5 years in a row. The number to call is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.